explore the human liver anatomy, parts and functions. Welcome to this detailed journey into one of the most remarkable organs in the human body, the liver. The liver is the largest internal organ and one of the hardest working organs in the body. Every second of every day, it performs hundreds of vital functions that keep us alive and healthy. From filtering blood to producing bile, storing nutrients, and removing harmful substances, the liver is essential for life. In this video, we will explore the anatomy of the human liver, its location, structure, blood supply, major functions, and the common diseases that can affect it. Let's begin. The liver is located in the upper right side of the abdomen, just beneath the diaphragm and above the stomach. Most of the liver is protected by the rib cage. In a healthy adult, the liver weighs approximately 1.3 to 1.8 kilograms, making it the largest internal organ and the largest gland in the human body. The liver has a reddish-brown color and a soft but firm texture. It has a unique ability to regenerate. Even if a significant portion of the liver is removed due to surgery or injury, the remaining healthy liver tissue can grow back over time. This regenerative ability is one of the most fascinating characteristics of the human body. The liver is divided into two major lobes, the right lobe and the left lobe. The right lobe is much larger than the left. These lobes are further divided into smaller functional segments. Each segment contains its own blood vessels and bile ducts, allowing surgeons to remove damaged sections while preserving healthy tissue. Covering the liver is a thin layer called Glissen's capsule. This protective covering helps maintain the organ's shape and provides support. The liver receives blood from two different sources. The hepatic artery delivers oxygen-rich blood from the heart, while the portal vein carries nutrient-rich blood from the stomach, intestines, pancreas, and spleen. This unique dual blood supply allows the liver to process nutrients immediately after digestion while also receiving oxygen to support its own cells. Blood entering the liver flows through tiny channels called sinusoids. These specialized blood vessels allow liver cells, known as hepatocytes, to come into direct contact with nutrients, oxygen, hormones, and waste products. Hepatocytes are the main functional cells of the liver. They perform hundreds of different chemical reactions every minute. They convert nutrients into usable forms, produce proteins, store vitamins, remove toxins, and manufacture bile. One of the liver's most important jobs is producing bile. Bile is a yellow-green digestive fluid that helps break down fats in the small intestine. Without bile, the body would struggle to digest fatty foods and absorb fat-soluble vitamins such as vitamins A, D, E, and K. Bile travels through tiny bile canaliculi into larger bile ducts before reaching the gallbladder. The gallbladder stores and concentrates bile until it is needed during digestion. When fatty food enters the small intestine, the gallbladder releases bile through the common bile duct. The liver also plays a major role in metabolism. After you eat, nutrients absorbed from the intestines travel directly to the liver through the portal vein. The liver decides how these nutrients will be used. Excess glucose is converted into glycogen for storage. When blood sugar levels drop, the liver converts glycogen back into glucose and releases it into the bloodstream. This process helps maintain stable blood sugar levels throughout the day. The liver is also responsible for metabolizing fats. It produces cholesterol, synthesizes triglycerides, and creates lipoproteins that transport fats throughout the body. Protein metabolism is another critical function. The liver converts amino acids into useful proteins and removes excess nitrogen by converting it into urea. Urea is then carried to the kidneys and removed from the body through urine. Another vital function of the liver is detoxification. Every day, harmful substances enter the body through food, medicine, alcohol, and environmental chemicals. The liver neutralizes many of these toxins, making them easier for the kidneys and intestines to eliminate. Alcohol metabolism occurs mainly inside liver cells. Excessive alcohol consumption can overwhelm the liver, causing inflammation, fatty liver disease, and eventually cirrhosis if the damage continues over many years. The liver also processes medications. Before many medicines become active or leave the body, they are chemically modified by liver enzymes. This is why liver health is extremely important when taking prescription medications. The liver stores many essential nutrients. It stores glycogen, iron, copper, vitamin A, vitamin D, vitamin B12, and vitamin K. These reserves allow the body to function even when dietary intake temporarily decreases. The liver produces several important proteins found in blood plasma. One of these is albumin, which helps maintain blood volume and prevents fluid from leaking into surrounding tissues. The liver also manufactures clotting factors. These proteins help stop bleeding after an injury. Without proper liver function, even small cuts could result in prolonged bleeding. The liver supports the immune system as well. Specialized immune cells called Kupffer cells live inside the liver. These cells remove bacteria, damaged blood cells, and other harmful particles from the bloodstream before they spread throughout the body. Healthy liver function depends on good nutrition and healthy lifestyle choices. Eating fruits, vegetables, whole grains, lean proteins, and healthy fats supports liver health. Staying hydrated and maintaining a healthy weight also reduce stress on the liver. Regular physical activity helps prevent fat accumulation in the liver. Exercise improves insulin sensitivity and reduces the risk of developing non-alcoholic fatty liver disease. Avoiding excessive alcohol consumption is one of the best ways to protect the liver. Heavy drinking over time damages liver cells and increases the risk of liver failure. Vaccination against hepatitis A and hepatitis B provides valuable protection against viral infections that can seriously damage the liver. Common liver diseases include fatty liver disease, hepatitis, cirrhosis, liver cancer, and liver failure. Fatty liver disease occurs when excess fat accumulates inside liver cells. It may result from obesity, diabetes, poor diet, or excessive alcohol consumption. In its early stages, fatty liver disease often causes no symptoms and may be reversible with lifestyle changes. Hepatitis refers to inflammation of the liver. Viral hepatitis can be caused by hepatitis A, B, C, D, or E viruses. Some forms spread through contaminated food or water, while others spread through infected blood or body fluids. Cirrhosis is severe scarring of liver tissue caused by long-term damage. Scar tissue replaces healthy liver cells, reducing the liver's ability to function properly. Advanced cirrhosis can lead to liver failure. Liver cancer may develop in people with chronic liver disease or cirrhosis. Early diagnosis significantly improves treatment outcomes. Symptoms of liver disease may include fatigue, abdominal pain, yellowing of the skin and eyes known as jaundice, swelling of the legs, nausea, loss of appetite, dark urine, and pale-colored stools. Doctors evaluate liver health using blood tests called liver function tests, imaging techniques such as ultrasound, CT scans, MRI, and sometimes liver biopsy. Treatment depends on the underlying condition. Lifestyle changes, medications, antiviral therapy, and surgery may all play a role. In cases of complete liver failure, liver transplantation may be the only life-saving option. Modern medicine continues to discover new therapies that improve liver health and increase survival rates for patients with liver disease. The liver is truly an extraordinary organ. It filters blood, stores nutrients, regulates metabolism, produces bile, removes toxins, supports immunity, manufactures proteins, and performs hundreds of life-sustaining functions every single day. Understanding how the liver works reminds us how important it is to care for this incredible organ through healthy eating, regular exercise, responsible medication use, limited alcohol consumption, and routine medical checkups. Thank you for watching. If you enjoyed learning about the amazing human liver, be sure to like this video, subscribe to the channel, and join us for more fascinating lessons on human anatomy and medical science.